Hi guys, I want to thank you for tuning in today. I'm actually coming to you to do a video about something a little bit different today. I want to talk to you about certified nursing assistant. And I happen to be a certified nursing assistant right now, newly certified. But the thing about it is I don't hear too many people talking about, on YouTube, about what happened in Mississippi, getting their certification. So I'm just going to enlighten you guys a little bit. I'm not going to keep you too long. I'm just going to tell you about some of the things that I went through getting my certification. First off, I work as a teacher, and I thought that the classes were going to get in the way of my work schedule, but they didn't. Actually, I'm full-time CNA. I'm no longer with the school district. So this is what it was. I did some research online because I did want to do something in the medical field. Now, I don't know how much farther I'm going to go with this, but this is what happened. I found a lot of opportunities for certified nursing assistants. Anyway, if you look on Indeed, anywhere, you can see that they are very much in high demand. So what I did was tried to find a class that I could take. And I did find one. I found one at a community college. And I went on and signed up. If you want more information about that, I can kind of, just leave me a message and I'll tell you about that. So orientation started and we got a chance to, everybody came, class was packed. Everybody came to find out what was expected of us and what we would learn during the course of the 6 to 8 week class. And we met 2 days, well, actually 2 nights a week from 6 to 9 o'clock. And during the course of that time, we learned all about our skills and we learned about what we would have to do on our tests. Now, this is the book that the skills are based on. And it's from Pearson View, but I'll put that in the description box. And this is actually the book that we had in class. And it also comes with a companion DVD. Let me let you guys see that. This is the book. And this is where your skills are based on. I actually have 2 copies. I should have bought on my 2016 copy, but this is where your skills come from. So basically your skills are based on this, and your written test is based on this book. Now, during the course of the class, you will have to wear scrubs. I don't know how lenient your teacher will be, but these are the scrubs. We had to wear red. And you will also get a little badge to go on your clothes, your student badge. And also, when it comes time to doing blood pressure, you will also have to have your pressure cup and your Sphygmomanometer. And this is in a cute little carrying case. And everything that you need is right in here. And this came from Prestige Medical. Everything that you need. And I've already got that in there. Got pretty good at doing everything that I need to do. And so, you will need that. But basically, what everybody's talking about is the test. What happened during testing? Well, about a month after we graduated from class, I got to know a lot of people, and we had a great teacher. I just really loved my teacher. She was just really so knowledgeable, and she was just so adorable. Okay, and so she always came to class upbeat, and it was just exciting to learn from her. Excuse my nails. I cooked today, and there's my polish. And so, about a month after finishing class, we were scheduled to take the test. And let me tell you, on test day, You need to be on time. And if you cannot make it to your, if you think you're not going to be able to make it to your schedule test time, you need to get in touch with them and call them 5 days, at least 5 business days ahead of time to let them know. And you got to let them know why you're not going to be able to make it. And I'm just going to tell you this: the written and the skills test together is $101. If you're just taking the written test, it's $32. If you're just taking the skills, it's $69. And I'm going to tell you this: I'm going to let you know this. If you take that written and the skills test 3 times and you don't pass, you're going to have to retake the course. You're going to have to have to be trained all over again. But when you do get down there to take the test, you need to have 3 number 2 pencils sharpened, and you need to take proper identification with you. Now, what I had was my driver's license, I had my social security card, and just a backup. If that wasn't good enough, I took my bank card. And so when you go into testing, you're going to go through all these rules and what you can do and what you can't do, and you start to test. And don't look around, don't talk, don't do anything. Just do what you're instructed to do, because if you mess up, you're going to be put out. After you finish your test, it's good to look over it. You can look over it until time is up, or you can just raise your hand to leave if you're finished. After that, when everybody's finished, they go on and they grade that part. They grade the written part. And after that, everybody comes into this waiting area where people are going to be paired up. Whoever's going to be taking their skills first, they're going to be paired up with someone that's going to be their patient. So it's going to be a real person. So there are certain skills that are going to require to use a dummy, but there are other skills that they're going to need a person. So basically, now this is what I noticed about how they paired it up. They went in alphabetical order for the people that were going to go in and do their skills. And then for the patients, they went from the bottom of the list. Because I was paired with a woman, her last name was R. It started with the R. And of course, being married, I still carry my maiden name, Anderson Stamps. So they went by Anderson. And so she was my patient. And both of us were, you have to be dressed in a way where they can access your arms and stuff. And you have to wear pants that are going to be able to roll up where they can access your legs, depending on what skill they're going to do on you. And so when you get in there, you're going to be shown where everything is, all the linens and the basins, Emerson's bowl, everything. They're going to show you everything. Depending on all the skills, you're going to know where everything is. They're going to take you over where your patient is going to be, and you're going to see the curtains, everything. You just need to not be nervous. Just be on point. You know what you have to do. Just go in there and do it. And so after that, you start on your skills. First skill, everybody, no matter what your other skills are, everybody's going to have hand washing or hand hygiene. Well, these are the skills that I had. Of course, everybody's going to have hand hygiene, like I said before. But the other 4 that I had were counts and records radial pulse, feeds client who cannot feed him or herself, gives modified bed bath, and that's going to be on the face, 1 arm, 1 hand, and 1 underarm. That's why you got to be able to have something that's going to roll up, or wear a short sleeve shirt or a tank top, because they're really going to have to wet you up. This is not something that you're just going to talk through. You're really going to be wet up. And after that, the last one I had was transfer from bed to wheelchair using a gait belt. So after I completed my skills, I then had to put on the gown, and then I played the patient. And at the end of the skills, when I was finished and the young woman that I was with was finished, they led us back to the room, and they came and got two more people. You know, I was lucky enough to know a couple of the people that were down. Some of the people that were actually in my class with me were actually there. So maybe that was why I felt so relaxed. So after that, we're sitting in the room, and the woman, she comes back with the scores, because they send the scores through one at a time. She came back, and I had passed. And so, oh, I forgot to tell you, before you go in for your skills part, when everybody finishes the written, they send your scores through. So you know, even before you go in to take your skills, if you pass your written.